So the aim of this session is really to zoom out and have a look at what is happening in digital health broadly across the Pacific, including some of the common trends that we're seeing, some of the major digital health reforms that have been happening, and also what is coming up next. And the session will really help to frame the rest of the forum. So it's a bit of a launching point for the sessions that are to come. So I'll also be pointing out some relevant sessions that you may wish to attend. So feel free to write on your programs. So first, I want to paint a bit of a picture about the digital health landscape across the Pacific and some of the trends that we're seeing. So, oh, just a minute. Minimize this. So digital health is really a cutting-edge area that has the ability to transform health systems, services and clinical care. It's considered an essential part of our progress towards achieving the Sustainable Development Goal of good health and wellbeing for all. The WHO Global Strategy on Digital Health highlights these factors as core principles of digital health systems. And what I'd like to highlight is that this forum is really a chance to see all of this in action. So to see how digital health is actively contributing to improving health systems and health service delivery in the Pacific Islands. We're also going to take a deep dive into some of the common digital health tools that are being used across the Pacific and how they are meeting each of these principles. And I hope that what we'll see in this forum is that the Pacific is not simply catching up, but in many ways is truly on a path towards leapfrogging other more resource settings in the area of digital health, with some truly amazing achievements being made right across the region. Digital health in the Pacific has had really quite significant growth in recent years, particularly over the last decade. We are seeing the use of purpose-built tools that are designed to flourish in the challenging environment of the region, with a preference for tools that are offline first and able to be used even when the internet is not available, and only requiring a short internet connection every now and then to synchronise data to and from a central server. In particular, we've also seen a trend in the uptake of open source software. And on day 3, we have Danya Hereth from the MSupply Foundation, who will present in more detail about open source digital health tools. So I really encourage you all to come to that session. On day 2, we also have sessions on other tools, including Open CRVS, which is a civil registration and vital statistics software, and also food tracking or crowdsourced syndromic surveillance. Now, some tools such as MSupply have been in use for a very long time in some Pacific Island countries, and MSupply is the world's most commonly used medical stock management system in low resource settings, and it's now used in almost all Pacific Island countries and territories. And this is something I think is really exciting, as it allows us to start seeing the benefits of having a common digital health tool used in the region, with localisation of support and peer-to-peer collaboration really starting to now materialise. And I'll talk through an example of that later in this presentation. We're also seeing increasing coverage of other tools that you'll hear a lot about during this forum. So I just want to spend a couple of minutes briefly talking to each of those so that everyone has a bit of background onto each of those tools. So we have Tamanu, which is an electronic health record, and it's been adopted by Samoa, Palau, Nauru, Tuvalu and Fiji in various capacities. In places where it would be used as the country's national electronic health record, ministries of health will be able to track a patient's entire health journey from birth to death, with their record accessible to health staff no matter which facility they visit. And this, of course, opens up a huge potential for analysing public health and health systems data that has not been previously available. Tupaya is a data aggregation, analysis and visualisation platform that provides a one-stop shop for health data needs. And it has data feeding in from other digital health software such as MSupply, Tamanu and others. and it's being used in the region, various countries to quite different degrees in lots of projects, and you'll hear about a couple of those throughout the forum too. CENITE is a laboratory information management system, otherwise known as a LIMS, that supports laboratory workflows. It's being deployed in Papua New Guinea, Samoa, Palau, CRVS and Nauru. And if you're not familiar with CENITE, our program manager will be running a demo of the platform on day 3. And of course, DHIS2, which is the world's leading health management information system, is used across Palau, Solomon Islands, Tonga and Vanuatu. We also have demo stations outside, just near where the morning is served, and they'll be running during the breaks. So if there's any of those that you want to see or learn more about, please just visit the staff there, and you can also see those systems in action. So with common digital health tools now available, another thing that we're seeing not only in the Pacific Islands but in other low resource settings is this shift from entirely new software development and pilots to larger national rollouts and a focus on the ability of technology to scale up, integrate with other systems and be sustainable and locally maintained. We've seen not only the development of comprehensive national digital health strategies in many Pacific Island countries, but also the execution of those strategies now starting to come into play. Comprehensive digital health suites are starting to materialise, with the BDS suite of products just being one example of that, and we'll hear about many of those experiences throughout this forum, including a panel discussion on the keys to successful digital health software implementations with delegates from Nauru, Palau and Samoa that all have large-scale deployments underway. With an emerging set of common digital health tools being used in the region, this is also opening up the possibility of really exciting national and regional strategies in health system strengthening. We'll hear about a couple of those projects throughout the forum, with a UNFPA case study on the use of Tupaia for regional projects and collaboration today, and another session by the Strive PNG team on the use of Tupaia for malaria resistance and vector surveillance also today. Of course, with the increasing amounts of complex data being handled through digital health systems, many lessons on data management have been learned in recent years, and we also have a really interesting panel discussing this tomorrow. We'll now walk through some of the major digital health advances across some specific countries that you're going to hear quite a lot about during these 3 days. So I'm going to give a high-level overview of what has been happening in the digital health space in Samoa, Nauru, Palau and Fiji to give those sessions a bit more context. So we'll start with Samoa. So in the area of supply chain, M-Supply is now used across all 15 health facilities in Samoa, with the national rollout being completed last year. And we're now really in a phase of long-term supply chain strengthening and optimising the use of M-Supply. In the clinical area, Tamani started being used in Samoa back in 2021 to support the COVID-19 vaccination campaign. It was also used for a typhoid vaccine campaign and an NCD screening program, and you can hear more about those at the Day 1 Tamanu Vaccines module talk and Day 2 at the National Screening Program session. More recently, Samoa has begun using Tamanu as its national immunisation registry and to record all births. This provides a unique medical record ID number, which will again follow the patient throughout their clinical journey from birth to death. Samoa have also recently begun a national rollout of Tamanu to all health facilities in the country as the National Electronic Health Record. And at the end of this, a patient should be able to visit any health facility in the country with their health record accessible to the treating team, really providing a level of continuity of care that is unprecedented. And so, as an example, you can't even do that at the moment in Australia or New Zealand, but by the end of next year, you will be able to do that in Samoa. And this is the sort of example that really highlights what we mean when we talk about the Pacific region soon leapfrogging more resource settings in the digital health space. For laboratory, there's a Senate implementation planned for early next year. And for data, Tupai is being used to visualise integrated health data, with data feeding in from MSupply, Tamanu and Tupai Meditrack surveys. So I, again, strongly encourage you to come along to a keynote presentation tomorrow by Manara Tupai, where we'll hear more about Samoa's digital health experience and also the panel discussion later that day, where Manara will also be part of a panel discussing keys to successful digital health software implementation, alongside colleagues from Nauru and Palau. The Nauru case is a really good example of a comprehensive digital health ecosystem with tangible impacts on workflows and patient care. So for supply chain, MSupply has been used in Nauru for many years, with long-term supply chain strengthening activities now underway. We also have 2 MSupply super users with us from Nauru who will be running MSupply masterclasses on day 2 from both warehousing and pharmacy dispensary perspectives. In the clinical area, the Nauru Public Health team undertook cardiovascular disease screening alongside COVID-19 and HPV vaccinations in the community using Tamanu mobile or data entry. This year, Tamanu was also used for a school health screening program, and you can hear more about that tomorrow at the National Screening Programs session. Tamanu's been fully deployed across the Republic of Nauru Hospital over 6 months earlier this year, which included comprehensive workflow mapping across the entire hospital, potentially for the first time ever. And in terms of impact, Tamanu is used at the very beginning of a patient's health journey to generate a unique medical record ID number and a card. So when a patient presents to Republic of Nauru Hospital, their ID card is barcode scanned to open the correct patient profile in Tamanu, so ensuring that the correct patient is selected, and again, providing a mechanism to ensure continuity of care. When a prescriber generates a prescription from Tamanu, it also has a barcode on it, which can then be scanned by the pharmacy staff to bring up their record in MSupply and allow them to dispense medications to them. Tamanu Desktop will also be rolled out to all public health clinics by the end of this year. In the lab also used Tamanu for processing COVID-19 lab requests and results. And then following this, Nauru has continued to use Tamanu for laboratory and imaging workflows at the Republic of Nauru Hospital. This is soon going to be followed by an implementation of Senate for more comprehensive laboratory information management. And in the area of data, Tupai is used to visualise data on cardiovascular disease screening, school health screening, and hospital reporting. And you can hear more about the Nauru digital health experience at the panel session tomorrow. The Palau case demonstrates the successful implementation of a comprehensive digital health suite. So MSupply has been rolled out across all of Palau's 9 operational health facilities, which was completed this year. And in the clinical space, Tamanu is used across all units in Palau National Hospital, and we have a facility case study on day 3 about that. Implementation of Senate at the lab has recently been completed, in fact, just in the last couple of weeks. And DHIS2 is the system used for health information. We also have key data visualised in Tupai for environmental health in the community and hospital reporting at Palau National Hospital. And once again, you can hear more about Palau's digital health software rollouts at the panel discussion tomorrow. And Fiji, our host country, has really made quite significant leaps in digital health recently, particularly in the health supply chain space. So a comprehensive health supply chain reform project with the Ministry of Health and Medical Services, which is funded by DCAT, is supporting digital health system use in this area. It includes the national rollout of MSupply to 230 facilities. And if we break that down further, 343 individual units and departments across the country. This is happening alongside other major supply chain reforms, covering warehousing, procurement, policy, and more. Fiji's also adopted several extensions of M-Supply, including Health Supply Hub for procurement, Conformer for medicines registration, and they'll soon be digitising temperature monitoring of fridges containing vaccines using the M-Supply cold chain app. Again, this all comes under an umbrella of a really strong plan for health supply chain in Fiji and the digital systems that support it. And there have been really massive impacts on warehousing, procurement, regulation and hospital pharmacy, which you can hear about today and tomorrow at the sessions on Health Supply Hub, Conformer and the M-Supply masterclasses. Clinical, so PADIS Plus is the electronic medical record system that's used at the major public facilities in Fiji. During the height of COVID, Te Manu was used to record vaccinations and generate international COVID-19 vaccination certificates. It's also been used more recently in a typhoid vaccination program and a mass drug administration campaign for neglected tropical diseases, which you can hear about today at the survey-based data collection case study session. Te Manu has also been fully rolled out across Bar Hospital and Lautoka Hospital, which is Fiji's second largest hospital. These hospitals are run by Aspen Medical under a public-private partnership with the Fiji Ministry of Health and Medical Services. Again, PADIS Plus is currently being used at the major facilities for lab workflows. During COVID, Te Manu was used to generate lab requests and process results. And there's another really tangible example of impact of digital health systems here, with over 200,000 patients able to view their COVID-19 test results online during that time, whereas previously they had to ring a call centre for their results. And then for data, SORMAS and EWAS are used for disease surveillance in Fiji. Tupai is being used for visualising data related to programs, for example, tracking the coverage of mass drug administration. Tupai Meditrack was also used for surveying all of Fiji's health facilities for data related to health facility infrastructure, medicines availability and services. The recommendations based on the survey results are now being used to guide resource allocation for health facility improvements. And you can hear about that initiative at the survey-based data collection case studies later today. Finally, let's talk through some common themes for what we can expect in the near future for digital health in the Pacific. So the future, first and foremost, lies with locally led solutions. The WHO Global Strategy on Digital Health highlights the importance of placing patients, families, communities, and importantly, health workers at the centre of digital health through ownership of digital health systems and health data. To support our health workers to do that, we also want to see the burden of reporting being shifted away from health workers into the digital systems themselves, so that reporting is automated simply by them using the digital health tools as part of regular health service delivery. Following this, we are already seeing, and will continue to see more, support for digital health being localised within the region. There are a growing number of digital health experts and system super users in the Pacific region, as evidenced by the people here today and online. There are a number of existing networks already for digital health support in the region, and you can hear about some of those across day 2 and 3 with presentations from the Pacific Health Information Network, Pacific Health Information Support Hub, and a keynote address from SPC, also known as the Pacific Community, on their support for digital health in the region. Building upon those existing mechanisms, BES will also be establishing a learning hub and support centre for its digital health tools based in Suva, Fiji, which will launch in Q4 of this year. And this will see level 1 and 2 technical support being provided locally across the region for Te Manu, Senite and Tupaia initially, leveraging the growing expertise of digital health users in the Pacific. The aim is that this centre will support not only technical troubleshooting, but supporting optimal usage of the systems and data for decision making. We're already seeing this sort of idea come to fruition in the health supply chain space via another mechanism that you may have seen the logo for on communications related to this forum, which is DTAC. So DTAC is the Data and Technical Assistance Centre for Strengthening Health Supply Chains in Polynesia, and it's jointly run by BES and the Supply Foundation and funded by New Zealand's Ministry of Foreign Affairs and Trade for the 6 countries listed here. With Supply used across most Pacific Island countries now, we're at the stage of embedding Supply into workflows, optimising usage, and again, supporting the use of data for decision making. And you can hear a bit more about Supply data for decision making and support on day 3. The use of a common system among partner countries also allows us to harness the knowledge and expertise of users within one setting and share that across another setting. And as part of the DTAC program, we've been facilitating peer-to-peer support through regional placements, partnering up supply chain staff from Samoa and Fiji, and Cook Islands and Niue as examples on knowledge sharing visits. DTAC has also produced a number of innovative mechanisms to support capacity building in digital health, such as the free online International Supply Accreditation course, which allows users to master the skills of Supply. So users work their way through different levels for Supply Mobile and Supply Desktop and achieve a certification after completing an accreditation test. We have over 850 participants from around the world that have signed up to the accreditation course, with almost half of those coming from the Indo-Pacific region. Now, as time goes on, of course, our existing digital health tools will continue to evolve. There are many exciting upcoming evolutions in the common tools being used across the region, and you're going to hear a lot about those over the forum too. So in particular, the team at the Supply Foundation have been busily working on developing a modernised open source version of their long-standing Supply software known as Open Supply. We have the Supply Foundation Director Craig Drown and several of the team's senior software developers here with us at the forum, and they'll be running 2 sessions on Wednesday, which will give us an insight into Open Supply and what the future might look like for logistics management information systems in the Pacific. We also have 2 sessions on upcoming features in Te Manu and Tupaia, including an interactive session with our Tupaia Program Manager, Georgia Lack, who would love to hear your ideas about what you'd like to see next. So have a think about that over today and come to that session with some ideas in mind. With digital health systems evolving so quickly, it naturally follows that digital health strategies and policies also need to be considered as dynamic. We and others, of course, are working with countries on their digital health strategies, and it's really important to make sure that strategies are being updated to meet emerging opportunities and reflect modern tools, rather than focusing too heavily on implementing outdated strategies. At the same time, there's a balance that must be struck. So policy work is, of course, very important, but it shouldn't become a blocker to implementation itself. The frustration in the past has been that digital health strategies and policies were continually written but never implemented. So we need to ensure we're not spending all of our efforts on rewriting strategies and policies rather than implementation. So I think a good balance is that once we have the overarching strategies in place, then we shouldn't hold off implementing for the sake of policy writing. Policy and implementation can be done together. So, in summary, it is a really exciting time for digital health in the Pacific, with a focus now on scaling up existing software, integrating them with one another, and ensuring that they're sustainable and can be locally maintained. Several countries in the region have comprehensive digital health ecosystems which are being implemented nationally, and we're starting to see the benefits of that to health systems and health service delivery. There are a common set of digital tools that are emerging across the region, and this is opening up the exciting possibility of fully localising support and collaborating regionally. Digital health in the Pacific is already and will increasingly be locally led and driven by communities. And as our digital health tools continue to advance, strategy and policy should evolve with them. So that concludes the plenary session on digital health in the Pacific. So thank you.